Hello everyone, and welcome to this video brought to you by NDEB Strivers. Dr. Mustafa here, and in this video we will be talking about the AFK Blueprint and references. As we all know, the National Dental Examination Board of Canada's process starts with the Assessment of Fundamental Knowledge exam, which is the AFK. So in this video, we will just try to explain the blueprint and what to expect about the percentages of different subjects that will come up in the AFK exam. We all know that we have 200 questions in the assessment of fundamental knowledge, and it might be a very good start to know exactly the percentages of the questions that you would expect in relation to different subjects. So that's what we will be doing in this video. So basically the objectives for the video is to learn about the AFK blueprint. We will also know a little bit more details about the first category in the blueprint and the references that are related to that first category. And finally, we will also learn and have a quick example of how to study for the AFK and how to use the references in a smart way. Let's jump into it. So the AFK blueprint is the percentages of the different questions that we will see in different subjects. So in this video, we will be talking more about the first category, which is the pharmacology and therapeutics, the local anesthesia, medical emergencies, medicine, including physiology. So this category, as we can see here, it actually takes a huge chunk of the exam, which is 24%. And it is actually the most important category in the whole exam. So we will be talking in more details about the different references that we have in relation to this category and the important topics that might come up in the AFK exam. It takes 24%, which is a huge percentage, right? So it's like almost 48 questions approximately out of the 200 questions. The other categories, we will be talking about them in the next videos. The second category is orthodontics, pediatric dentistry, geriatric dentistry, and special needs, including oral embryology and growth and development. There is also the periodontics category, which takes 10%, as well as the ortho and pedo category as well. Endodontics takes 6%. Oral medicine has 17%, oral medicine and oral pathology, including the histology and oral radiology. This takes 17%, which is also a huge percentage. It's like the second most important category after the pharmacology and therapeutics category. And then we have also the evidence-based dentistry and infection control and ethics. This takes 7%. It is becoming very important also in the recent exams, especially the ethics category. And oral surgery, trauma and oral and facial pain, dental emergencies, and anatomy. This takes 10% of the AFK exam. And lastly, we have the cardiology, including the microbiology of that, the biochemistry, restorative dentistry, orthodontics, and implants. So this also takes a huge percentage. So as we can see, we have 3 categories that are actually above 15%. So the main idea of knowing the blueprint is that you want to already start directing your energy in the beginning towards the chunk that is very important and you will see more of in the exam. So those 3, that they might be a good start, and we will try to explain them all in the next videos. So if you are interested in knowing more about that, subscribe to the channel, and you will get more updates about the rest of the categories. So in this video, we will be talking about the first category, as we said, which takes 24% of the assessment of fundamental knowledge exam, which is about 48 questions in the exam. So this category, we will divide it into 4: pharmacology and therapeutics. The second one will be local anesthesia, medical emergencies as a third category, and then lastly, we'll talk about medicine and physiology as well. So beginning with pharmacology and therapeutics, which is one of the most important topics in this category, the references and articles that are mentioned in the NDEB reference list is the one that you are seeing now. So we extracted all the references that are related to pharmacology, and we have them now in front of you here. What I would suggest is that you want to choose some of the references and try to have them with you. And as we said in the beginning of the video, that I will tell you exactly how to use the references in a smart way. So we will talk about this in the next videos, in the next couple of slides, I mean. So this is the reference list. I highlighted 2 of them that are, in a way, can be very useful to start with and to have them in your in the laptop, for example, or as a hard copy. So Goodman and Gilman's Pharmacological Basis of Therapeutics is an important book. And the also Pharmacology and Therapeutics for Dentistry, which is also a very important book. So I used to have this one, and I will show you exactly how to sometimes refer to the references in a smart way. You also have the articles that are related to pharmacology and therapeutics. Infective endocarditis is a very important topic that has 2 actually articles in the list of the articles in the NDEB reference file. And also the role of opioids in the management of acute and chronic pain in dental practice. This is also an important articles that also is mentioned, and it's very important. So the important topics that are actually very important to know about in the pharmacology and therapeutics category is the pharmacokinetics and pharmacodynamics. It is very important as part of the basic of the pharma. So knowing this is very important. The analgesics and antibiotics, and especially analgesics and antibiotics that are actually used by us dentists, more regularly, like in the dental clinics, it's very important to know the antibiotics and the analgesics. And something that's very important related to this category here, which is the drug-drug interaction, because this is a huge category, right? If you ask, drug-drug interaction is something that is very broad. I would suggest that knowing the drug-drug interaction for the analgesics that are most commonly used by dentists and the antibiotics that are also, we usually prescribe for patients, this is the most important drug-drug interaction categories that you want to start with. And then you can expand more into going into the other kind of drugs or systems. But always focus with the drug-drug interaction that's related to analgesics and antibiotics that are commonly used by dentists. There is also a very important topic that's the diuretics and their different categories. And we will also have our example of using the references is actually related to diuretics. So we will talk about this in the next slide. Then we also have the different systems, the ANS, CVS, and CNS. It's also very important to know the pharmacology and therapeutics related to those 3 systems. I would say, personally, it's important to know the very just general and important medications that are very commonly used. but it's I would give it like a second priority. It's very important to focus with the analgesics and antibiotics and the drug-drug interactions related to this, and the basic of pharmacokinetics and pharmacodynamics. And then you can move to exploring the other systems. So as a priority, we all know all those topics are important, but as a priority and as a, like, let's say the percentage of having a question from this in relation to the percentage of having a question from this category. So this is just how you should prioritize things. The antithrombotic therapy is also a very important topic because it is related to the, like, anticoagulants and antiplatelet. It's very important and related to the bleeding emergency that can happen after dental surgeries or extractions. So it is an important also category in terms of pharmacology. Okay, so now let's have just a little bit of an example, a short and a very simple example to demonstrate how you can use those references before we continue in the other three categories in this subject. So this is a simple question that I just made myself. So the site of action of hydrochlorothiazide along the nephron is A, the proximal tubule, B, the thick ascending limb of Henle, C, the distal convoluted tubule, or D, the collecting duct. So as we all know that the nephron has different parts in the kidney, and every actually one of the diuretics is working in a specific side in the nephron. So we talked already in the first video about how we always want to start with the question and then expand our knowledge about the topic that is related to that question. So the question from mock exams that you are having with one of the institutes, for example, if you are taking a course, or the released question that are already in the NDEB website. So for example, if I have a question like that, what I would suggest is that I would go to the reference list that I have. And I have the Pharmacology and Therapeutics for Dentistry, which is also called the AGALA, right? So I would open the reference, and then I can type into the search here, diuretics. So then I will get the diuretics drugs, or I can also look into the reference like list of content or the table of contents here. After seeing this, and after going to the reference in this in the book, then you want to find, for example, the answer for your question, for the specific question. So we know that we have a question about the thiazide, right? Like, that's the first thing that you have to know, is that, first of all, you have to know that the hydrochlorothiazide is actually one of the thiazides, right? So thiazides are easy to remember because they all end with the, like, most of them, they have the word thiazides in the name. So knowing now, like, seeing just a simple picture like this one, so now you know that the distal convoluted tubule is where the thiazides actually, they work, right? So now we know that the answer for this is C, but what should be the trigger is that you have a question now about the diuretics. So what you want to do while you are studying and preparing, and while you still have time, is to actually make notes. So take a screenshot, for example, of this from the book, because now you want to know actually where the loop diuretics working and the different names of the loop diuretics as well. You also want to know about what works in the collecting duct, and what about the proximal convoluted tubule. So now you know that the diuretics is an important category, and now you have a question about that. So after answering the question, don't just stick to answering the question. You need to really try to dig deep into the rest of the diuretics, the different types, different mechanism of action. You want to know also their effects on the electrolytes and so on. So while you still have time, let's say if you have 4 to 6 months to prepare for the exam, do the effort in trying to really look deeper into each question instead of just knowing the answers of the questions. One of the benefits of joining a specific course with an institute after making your own research about which institute can be really helpful is that some of them, they really have very good summaries for the different topics that are very important. And you will just want to know that if they are really updating their content and if it's a reliable kind of content that is very updated. Most of them are reliable, and just the updated part is something that you really want to try and know. But other than that, joining a course can be really helpful in terms of giving you the source for looking for information. So for example, if I am joining a specific course and they provided me with certain books and certain references that are already part of the NDEB list, so I will look into my notes that is already, because they did the work for me and that makes my life easier, right? So you would just look into the notes instead of going to the reference. So it goes both ways. In the beginning of my preparation, I scored 73 in the first exam in February, and I just did this, and it actually worked very well. 73 is not a bad mark. I know I didn't pass, but it was also a very good beginning that I made a lot of notes and I made a lot of summaries from the references. So starting by doing this or also having your source from the courses, they can be really very helpful from the courses. So always ask about if the notes from the courses are going to be helpful in preparing for the exam. All right, so moving on, the other categories, we have also the local anesthesia category. It is very important. You can use Malamade Handbook of Local Anesthesia. It's a very good book for local anesthesia. It's a very good reference. The important topics for local anesthesia is just as the usual kind of questions that usually come up in relation to local anesthesia, to LA, which is the types of anesthetic solutions and the role of epinephrine or the vasoconstrictor in the solution itself, the different techniques and their use. This is also very important when we are using the intrapulpal injections or this or that. It's also very important to know which block technique that you are going to be using. The calculations for the doses is also very important. The local anesthesia complications and toxicity. So those are the important topics in relation to local anesthesia, and this is the reference for it. Medical emergencies is our third category, and I would say this is extremely important topic. This is a crucial topic. You need to know it in and out, and it's a very important topic. So the references for this are Malamade as well and Little Amphalis, and those are all the list of the references that are there. You want to have at least like 1 or 2 of those references to try and look for information and to look for the most updated information related to this category. So here, the most updated category, like information and knowledge that you want to know, because it keeps changing, like how you want to manage a specific medical emergency is actually changing with time sometimes. So you really want to know what's the protocol in Canada and what's the best way to deal with the certain specific medical emergency. So the most important topics, actually medical emergencies, it's very important, all of it. So you really need to know it in and out. CPR is a very important topic that have been a subject of interest in the recent kind of cycles for the AFK exam. Cardiovascular emergencies, whether it's hypertension, ischemic heart disease, CVA, congestive heart failure, or cardiac arrhythmias. They are very important. Endocrine disorders, for sure, the diabetes mellitus, acute adrenal insufficiency, the hypo and hyperthyroidism, those are all very important topics. The perioperative bleeding and how to manage that, it's a very important also emergency. Asthma and COPD, or the chronic obstructive pulmonary disease, is also very important. Kidney and liver disease, you want to know about them and how they can show up as an emergency, or like how are you going to be treating a patient who's with an end stage renal disease, for example. GIT disease and radiotherapy and chemotherapy as well. So knowing those topics in and out, and as Dr. Neha said in the first video, knowing the whole concept and not just answering a question that you will be seeing is very important. So if you saw a question about angina, for example, you want to go and read all about the angina patients and what triggers that, what type of medications that you should be giving if you have an angina attack happening in the dental chair. And asthma as well, all of them very important topic. The last topic that we are having here, and I would say it's the least important topic, which is medicine and physiology. It is important to know the physiology generally and the basic. There is Ganong's, and there are a lot of books here you can look for and you can have as a reference. What I would suggest is that you want to know actually the physiology that is related to a specific emergency that can happen. So for example, we have the diabetes mellitus, right? Like diabetic patients, very important topic, very important to know about the medications that you want to use with the diabetic patients, their mechanism of action, how they affect the body, and the effect of also of insulin. So to know, since you are already doing the diabetes, you want maybe to know a little bit about the insulin role in terms of the physiology and how it actually regulates the blood sugar. You want to know also the blood pressure regulation and the normal physiology of the blood pressure before you jump into knowing the problem with hypertensive patient. So I would say just have a general basic knowledge about that, because it just helps with understanding the mechanism of the medication and everything. But to say that it is as a category, it's a very important category, I wouldn't say that. I would say it's just a category that will help complementing this whole category here about the pharmacology and therapeutics, local anesthesia, medical emergencies and everything. So it's just a complementary subject here. You want to know about the blood coagulation cascade while you are reading about the anticoagulants, for example. So try to relate the clinical sense with this category instead of just focusing on the basic of the physiology. All right, so that will be it for this video for today. I hope you guys had a lot of information and benefit from this to help you start for your AFK preparation for February exam. If you want to see more of this, subscribe to our channel, and we will be posting more videos about the AFK exam in the next couple of months. And stay tuned for that. Thank you so much. We'll see you in the next video.